Thank you, Peter. Good afternoon, all. My name is James Michel. I'm the Chief Executive Officer of Access Health Connecticut. I'd like first to thank Governor Lamont for joining us today, and also our other panelists as well. This has been a busy time at Access Health Connecticut. Open enrollment ended this past Saturday. We enrolled a total of 112,634 Connecticut residents, and they were all enrolled in quality health insurance plans through Access Health. This represents a 7.3% increase over last year's enrollment numbers. So we're very proud of that at Access Health. And now I'm excited to announce a new program, the Broker Academy. The Broker Academy is the next step in achieving our mission to reduce health disparities and reduce the number of uninsured residents in our state. The goal of the Broker Academy is to create a pathway for Connecticut residents who live in historically underserved communities to become licensed health insurance brokers. Despite Connecticut's high ranking in wealth and health, there are substantial disparities in the health status of and in the health care delivered to lower income Connecticut residents, especially communities of color. By activating members of these communities to become brokers, Access of Connecticut can build trust by meeting members of the community where they are, and at the same time create economic benefit in those areas. We are currently recruiting now for cohorts in Hartford, New Haven, and Bridgeport. My colleague, Tammy Hendricks, will give you a more detailed presentation about the entire program. Right now, I would like to turn the discussion over to Commissioner Andrew Mays. He is the Commissioner of the Connecticut Insurance Department.
Thank you, James. And I am so thrilled to be here today because, as we know, expanding access to insurance is vitally important to the citizens of our state. People need to be able to minimize their risks, and this is especially important, as we all know, in underserved communities and for residents who are living paycheck to paycheck, who simply may not have the resources to cover an unexpected event out of pocket. Health insurance coverage is vital, and if we look back at the past 2 years, what COVID showed us is that there was a disproportionate impact in underserved communities, both because of the lack of immediate access to coverage and because of the insufficiency of ongoing treatment beforehand to reduce what we've all come to know as comorbidities. Having a licensed, knowledgeable local broker in underserved communities will provide greater access to, and it will increase the opportunity for coverage, especially at a time when health insurance is more affordable than ever for many through Access Health and the subsidies provided by the American Rescue Plan. Insurance is complicated enough. We all know that. Having people in the community to explain insurance is good for consumers. For example, that's why one of the first things I did after Governor Lamont appointed me was to open up the insurance agent licensing exam to the Spanish-speaking population by providing it in Spanish. Removing that barrier to get an agent a license was a giant step to having more Spanish-speaking residents get the insurance they need. And today we are here to celebrate another step on the road to equity and justice, which I think we all know has been a hallmark of this governor and this administration. This is good for consumers. This is good for the economic health of our community as well. And I applaud Governor Lamont and James and Access Health for this new program. James.
Thank you, Commissioner Mays, and thank you for your leadership and guidance as we move forward in this direction. At this point, I'm going to turn the presentation over to Tammy Hendricks, our Director of Health Equity and Outreach for Access Health Connecticut. She's going to walk you through the features of the Broker Academy at Access Health. Tammy?
Good afternoon, everyone. Thank you so much for your support. Governor, our team is very excited to launch the Broker Academy to help underserved communities throughout Connecticut. So the Broker Academy is a program, the first of its kind actually, specifically created for individuals who live and work in underserved communities in Connecticut. Because this is our first year, we're looking to start recruitment from the greater Hartford, New Haven, and Bridgeport areas. The first class date is slated to start June 1st. But the Academy will guide candidates through the process of becoming licensed insurance brokers for free. Access Health will cover the cost of training, the exams, will give students a laptop, which they will then get to keep after they've completed the program. Training will be provided by a state-approved, industry-leading pre-licensing company, and they'll provide all the necessary class materials, study resources for the students. This is great because it'll be a hybrid learning experience, which offers flexibility for the students, and they only have to come in for a 3-day in-person class. But we didn't want to stop the program there, right, after they become licensed. We wanted to make sure they get hands-on experience before entering the field. So we're working closely with the broker community as well to have experienced brokers serve as mentors for the students, ensuring their success throughout the program and after. So we have Caesar here, who's a broker that's worked closely with Access Health for years and is excited to serve as a mentor. And he is working closely to support the program as well, because we do value the feedback of the brokers that we currently partner with. You'll hear from him shortly. But to further promote the program, our team is engaging with community-based organizations and partners. These organizations know the communities well, and we are really their knowledge will really help us find good candidates for the program. So for candidate qualifications, we are looking to recruit 100 students total. You need to be 18 years or older, a minimum of a high school diploma or GED. But more importantly, we want each candidate to have a demonstrated history of community involvement, which will heavily be weighted throughout the application process. And we're requiring community service of some sort to ensure that these newly licensed brokers can go back into the communities and really connect with the residents and help with enrolling and educating as well. So the Broker Academy is really a special program. It does 3 things. It addresses the rate of the uninsured. It helps reduce health disparities, right? Having these local brokers enroll and educate consumers about using health insurance and promoting preventative health. But there's also a huge economic benefit for the communities and students as well, right? These new brokers will have new lucrative careers. On average, there's a wide range. Earning potential is unlimited depending on how many policies that are sold. So this is really a career based on how much effort is put in. So there could be significant upside for income. But to wrap up here, we really encourage everyone to spread the word about the program. If you know someone who's a leader, an advocate in the community, committed to helping others, or they want to make a better living for themselves, please encourage them to apply. The online application will be available this Friday, the 21st. And for individuals who do not have access to a computer, paper applications will be available at our Navigator locations in New Haven and Hartford. We are working on a Bridgeport location as well. We want to make sure that the lack of access to technology doesn't prevent good candidates from applying. So we did make paper applications available. So all this information can be found on the Access Health Equity page, including the full health disparity study that we did. And based on that study, that's what really led to the creation of the Broker Academy and for the Health Equity and Outreach Department as well. So I encourage everyone to read the study or watch the short video to understand what health disparities is and how it negatively affects communities, particularly Black and Brown residents. But if we're more aware of what's happening, we can start working together, really make a difference. And the Broker Academy is really just the start for us. Our team has worked extremely hard standing this program up, and we really look forward to making a difference across the state.
Tammy, thank you very much, Tammy, for for your presentation. And then again, the website is accesshealthct.com. I'm going to introduce Cesar Cortez now. Cesar is an experienced broker. He has been with Access Health since we started back in 2013. And he has graciously agreed to be one of the mentors for many of our new licensed brokers at the end of the summer. So Cesar's going to talk to you why he thinks this program is so beneficial to the communities across the state of Connecticut. Cesar.
Well, hello. Thank you for your time. I really appreciate giving me the opportunity to discuss some of the benefits that I really see that this program is going to produce, not only for, again, the individual, but their surrounding communities, their friends, family, their surrounding businesses, and eventually the state of Connecticut. A more profitable community is a more profitable state. And it all starts with, I believe, the education. Education is power, knowledge is power. I myself came from a mentoring program when I first came to the state of Connecticut in 2007. I was lucky enough to find a Spanish-speaking gentleman who understood my background, understood where I was coming from, being from an underserved community, not having a lot of rich family and friends. And he was able to mentor me, able to train me, certify me, and then hire me and put me in the position of within 3 to 4 years to build my own business, and a very successful business that we started in Bridgeport and now have expanded across the state. And that all started by simply doing what we knew best, serving our friends and family, going to the faith-based organizations, the local community centers, the churches, the libraries, and doing free presentations about the value of health insurance, the value of having self-care, self-reliance, so that you don't become a burden to yourself, your friends, your family, but also to the state. And as you all know, again, a stronger society makes a more successful and prosperous state and communities. So as a mentor myself, looking to mentor additional people, I'm looking to create centers of influence. I'm looking to create and build lifelong generational benefits where our future kids can learn from our parents about the importance of having preventive services, understanding the language and what they need to do when their doctors ask them to do things. Because again, we don't know how much time we have here on earth, but we wanted to make it a quality life. We want to be able to spend as much time with our kids and grandkids, and that starts with your overall health. And having better health would allow you to have a greater income because you'll be able to spend more time working and developing skills and talents versus dealing with your overall health. So in the mentoring program, we're looking to mentor, hire individuals from these underserved communities so that they're able to learn the business the right way. We are tired as brokers, looking at individuals in the community and saying, why aren't you not in the business? Why don't you have health insurance? Why are you not talking about this? It's not a conversation they don't want to have. They have every day. It's that they don't know how to have it, who to have it with. And it's not a lack of resources and information in the state. It's really about the improper channel that we're using to distribute that information. And it starts with that individual person that we're looking to mentor from the community so they can go back to the community and provide that proper information, that real good information, not be misinformed about what they heard from cousins and friends' experiences that we all have. But it's important to train people from within their own community so that they build a trust, a relationship, and it allows doctors and even services in Connecticut to expand because we're all on the right channel. We're all in the same program. I think it's a great platform. And I myself, coming from a platform like that, I think this is an excellent opportunity for the state of Connecticut, Access Health, and all the communities, not just underserved, all the communities to get involved in our health. Thank you.
Thank you. Thank you, Cesar. Now we're going to go to Governor Lamont for his comments. Then after that, we'll take some questions. Governor Lamont.
Hey, thank you, James, and everybody. Hey, Cesar, you got to talk to the 5% of the people of Connecticut who still don't have insurance. You are compelling, and I'm glad you're going to be a mentor in, Tammy's Broker Academy. And I hope there's 100 more of you out there able to convince people this is the right thing to do. Look,
thank you,
James, Michelle, and Andrew. I mean, we have an amazing product out there on the exchange right now, and it's virtually free to everybody. It should be virtually free too. And and a lot less cost, at least for the next year, for people earning, up to $100,000. I got to tell you that that we've learned the hard way. I think this last couple of years what disparities mean and what it means when you don't have health insurance, when it means you don't get access to a test or a vaccine in this period of COVID. And that's not just puts you at risk, it puts your community at risk. So that's why we're making this extra effort to make sure that nobody is denied the opportunity to sign up for Access Health. I can tell you just in passing that our infection rate today continues to trend down slightly, 16.5%, but the trend is good. We're the 41st in the country. There are 40 states that have a higher infection rate than we do, but don't take that for granted. We still have a 16.5%. Hospitalizations are down, so that's a really good thing. We have 150 more empty beds than we had 2 weeks ago, and more nurses coming back. But that is all the reason to say we have an amazing healthcare system there. We're working through COVID, but you're so much better off if you have health insurance. You're so much better off if you're on the exchange. You're so much better off if you have a primary care person. And it's not like build it and they will come. I mean, we found that when it came to vaccines and testing, when it came to, summer camps for our kids coming back to school, we had to do real outreach from trusted advocates to convince people this is the right thing to do. And that's what this Broker Academy is all about. It's folks from the community going to these underserved communities saying, I come from a household not too dissimilar from you. Maybe I was hesitant at one point. Let me tell you how transformative Access Health has been for my family and what it can do for you. And I'll just leave you with the fact that I've tried to do this broadly across state government. I'm really proud that we have the most diverse state government leadership in history, that people look at our government and say, hey, there's somebody like me. We're working hard to have the most diverse teacher corps in the history of this state, to make sure that every kid has a mentor they can look to and they can learn from going forward. When it comes to police, we're adding on more police than ever before, and more state police. And I want them to be diverse in terms of ethnicity, in terms of gender. I want them to be from the community. When you're from the community, you're part of a community. When you're part of a community, you're much better able to, in their case, keep the peace. In our case, sell this product in a way that makes sense for people. So I want to say to James in particular, and all the folks at Access Health, this is extraordinary. You've got this amazing product, lowest cost, no wraparound for anybody that can't afford it. Let's make sure everybody has that opportunity. And if you all listen to Caesar, they will.
Okay, thank you. So we'll now take questions starting with on topics. So please hold your off topics until the conclusion of on topic questions. If you'd like to ask a question, please use the hand raise function in Zoom. We'll start with Paul Hughes of the Waterbury Republican American.
Yes, speaking of Waterbury, how come the state's 5th largest city isn't being included in this? It always seems that it's whatever the program, it's Hartford, Bridgeport, and New Haven. So can someone explain to me why this program isn't being extended to Waterbury?
Mr. Hughes, James Michelle, eventually we will get to Waterbury. Right now, we are using data out the gate. And our data shows that the 3 highest uninsured areas are Hartford, Bridgeport, and New Haven. Now, we know Waterbury is also a has higher uninsured as well. The program will extend to Waterbury, Danbury, and other high uninsured areas as well. Now, I want to stress that we said the greater Bridgeport area. So you may have some folks who live in Waterbury who grew up in Bridgeport, grew up in New Haven, where they may be able to be helpful, and they could participate in the program as well right now. But right now, our focus right now are the 3 highest uninsured areas, just to get the ball moving. Eventually, we will expand beyond those 3 communities as well.
Well, what's the plan? What's the timetable?
Well, right now, the plan is to get 100 brokers in the communities by late summer and early fall. After that, we'll start another class.
Okay. All right. Thank you very much.
You're
I
welcome.
will follow up later.
Thank you.
Brian Scott Smith.
Yeah, I just want to follow up on what the governor said about low-cost insurance, which for many, yes, it can be because it's being supplemented. But I just want to put this question to the governor and also to James Michael as well. It is all about cost, obviously, at the end of the day, as to whether or not people can afford the premiums. But when the deductibles are still pretty high, you know, where does that put people in still being able to use this insurance? I mean, surely if they can't afford the deductible, but they're paying for a premium, even if it is low, of what use is that to them? And the second part of the question, and this is probably for James, is how independent are these brokers going to be? Obviously, we expect Access Health to be independent. So I'm guessing that all of these brokers will be independent because with respect to Mr. Cortez, he's part of MetLife, which is just one insurance company. So clearly he would be pushing, you know, a particular product.
You want to start with that, James?
Sure. As far as independence goes, the brokers will be completely independent of Access Health. We will train again, we are targeting communities where there are no brokers. So if there are brokers, they're very limited, and this limits access to health insurance, which drives up the uninsured and drives up the health disparities. So our role in this is to create a path to recruit, develop, train, and get certified and get licensed brokers in those communities. Once they are licensed, they will be completely independent of Access Health. Now, I must say that right now we have 400 brokers, a little bit more than 400 brokers who are certified by Access Health to sell insurance on the exchange. And those 100 will be added to that 400, to those 400 plus. Again, they are completely independent of Access Health. We don't get anything from them other than the benefit of them doing good work for their communities and helping us to lower the uninsured and move closer to eliminating health disparities in Connecticut, which is core to our mission, core to our existence. I hope that was helpful.
Yeah, I just want to clarify that point with you, Mr. Michael. And obviously I wasn't clear when I said about independent. Are they going to be truly independent brokers? They're not tied to any one particular insurance company. So i.e. they're not going to be pushing it from just say, you know, Prudential or whoever, that they will be able to give options to people. They are truly independent in the advice that they are giving.
Yes, they will. Currently, if you want to sell insurance products on the exchange, you have to be appointed by the two insurance companies who are currently in the exchange. That is Connecticut and Anthem. So they will both be linked to both insurance companies. But the advice they give, again, they are agents, not brokers. So the advice they give will be what is in the best interest of their customer. That is their fiduciary responsibility, and this is part of the training that they go through when they are prepared to take the exam.
Okay,
all of our brokers are independent, are independent agents of, for the industry. And
Governor, can you just pick up on that point though about, you know, low cost, which we know that the premiums have gone down and they are, you know, they're a lot lower than they used to be. But like I said, the deductibles in many cases are still pretty high. You know, you have to obviously be able to pay that deductible to even get any to even get any like medical coverage.
Yeah, Brian, that's the right question, and maybe Tammy or somebody can help me. But there's an old phrase: I can afford the health insurance, but I still can't afford the health care. And that's because of co-pays and deductibles and a lot of the other games that are out there to discourage you from using the health care. Some of it's preventive health care. So I know that in our budget, the state has provided some wraparound support to reduce or eliminate the co-pays or the deductibles up to a certain income limit, really to make sure that everybody has access, not just in terms of the premiums, but also being able to afford the health care.
Governor, thank you. And James, thank you.
You're quite welcome.
John Moritz, Hearst CT Media.
Yeah, could you go back and provide some more information? I mean, how many people are going to be going through this first class of brokers? And then when they graduate, I mean, who are they actually going to be working for? Who's going to be paying their salaries and what type of placement services are going to be in place to ensure that these folks get jobs when they complete the program?
So I'll start off, then I'll pass it off to Tammy. The initial recruiting will include 100 brokers, 100 candidates to become brokers in the state of Connecticut. And we are targeting the greater New Haven, greater Bridgeport, and greater Hartford communities. That's 100 in total. And we will pay for everything involved in preparing them to take the exam and also taking the exam and also pay for the licensing. But those are all costs or barriers to the average person getting a license. But we're going to remove those barriers for them. And once they are licensed, then we will certify them for access to become agents on the exchange for the two carriers in the exchange. Then once that's done, Tammy, can you talk about the mentoring program? And also, I want to stress that we will have a stipend to get them started once they get started. We also provide them a broker. We also provide them a laptop to get them off the ground. But the most of their salary will come from the commissions they will earn working as an agent in Connecticut. And then right now, the commission rate in Connecticut for a broker and for an agent that sells insurance through the exchange is $15 a month per member per month. That is for example, if you were to enroll 1,000 people through the exchange, you could earn $15,000 a month. So that's the income source. And the good thing about that is that money is already in the system. It's part of the premium people are paying already. So there's no additional cost to the state or to anybody else. So Tammy, can you talk a little bit about the mentoring program?
Sure. And to expand on the income, brokers it's typically commission based. So there's no starting salary. It's really a career that they can build on, and it's based on the amount of policies that they sell. So to ensure their success, we did set up a mentorship program towards the end. So after they become licensed, they will then get matched to an experienced broker that has partnered with Access Health, like Caesar, and they will get hands-on experience before they enter the field. And so they will have that experienced broker to lean on for information after they've become licensed to help them.
And then do you have how much is the total program in terms of training going to cost? And how long is it going to take from when they begin in June until they're actually ready to begin their careers out on their own?
Okay, so the program is free. Access Health is covering the cost of the training and the exam. The first class starts June 1st. They do a 3-day training. Then they will have a period of time where they can study at home with all the resources that are provided from the pre-licensing company. And we are projecting that most students will be fully licensed by the end of July, moving into the apprenticeship program from August to October. And then they'll get that hands-on training right before open enrollment, which is November. So the program essentially goes from June. It's flexible. It's a flexible schedule. They study on their own. They apply for the exam, and then they start the apprenticeship, which is also another a flexible schedule for students as well.
Hey, Tammy, this sounds like a good deal. How do I sign up?
So the applications will be available. The online application will be available this Friday. So if you visit the Access Health website, the Broker Academy will have its own page, and it's a very simple application process. If a candidate does not have access to a computer, we do have paper applications available at our Navigator locations, Project Access in New Haven and CRT in Hartford. But we will have an email set up. So if any questions, if anyone has any questions, feel free to email the Broker Academy email and we'll get right back to you.
Okay, thank you. Do we have any more on-topic questions for our guests today?
Yeah, sorry, I just wanted to follow up on more. The cost of the program to the state, how much total is the state spending on this training program?
So the state is not funding any part of this program. This program has been funded by Access Health. As you know, we are funded through an assessment on the industry. And our core mission when we first created was to lower the uninsured and help to address health disparities. We think this program helps us to achieve both of our core mission that was created for us back in 2013. But this program allows us to apply for grants from a different number of sources. And we've already received one grant, and we are applying for other grants. But the program is been fully funded by Access Health with grants that would defray the cost of this program. So there's zero cost to the state of Connecticut for this program.
And how much is Access Health paying for it?
Right now, we're estimating, depending on, right now we are negotiating right now with the trainers. It'll be somewhere between $200,000 and $300,000. And again, we've already received some grant funding that will lower the cost to Access Health. And we are in the process of applying for more grants.
All right, thank you, James.
We believe this is a win-win all around. We get more brokers, help to address health disparities, lower the uninsured, and people are making more money because they're working hard to earn that money. And the insurance companies get more insured people. So everybody wins on this thing. And so we look forward to the challenge of executing and delivering on our promise to the governor and the people of Connecticut.
All right, so we will move to off-topic questions now, starting with Paul Hughes.
Yes, well, Governor, I guess the big news of the day is Mr. Stefanowski has ended the speculation. He's in the race. You didn't seem too fazed by the prospects yesterday when we asked you about the possibility. Just wondering what your thoughts are today, if you have any responses to any of the things that he had to say.
I think the big news of the day is that Access Health has a broker academy. We're going to get up to 100% of our people with a very affordable health insurance and what that means. Look, Paul, I can respond to every single hit that comes from the political world, but I'm trying like heck to focus on the job at hand. And right now it's getting us through what I hope is the ninth inning of this pandemic. Keeping our economy moving, keeping our kids in school, and getting this economy growing for everybody. That's what I'm going to focus on.
Do you have what about your announcement? You registered as a candidate, but you stated at that time that you were planning to have a formal kickoff later. Where do those plans stand?
I guess we plan to have a formal kickoff later. I've got a legislative session that's coming up. We've got a fair amount on our plate, so I'm going to take care of business first.
And just one final question. Has a day been set when you will be meeting with the legislative leadership to present your recommended list of COVID-19 policies and initiatives that you believe should be continued beyond the current expiration date of the emergency declarations?
Yeah, today, I think in a couple hours.
Okay. Where? Will it be Zoom? Will you be meeting in the office, your residence?
I think the whole world is virtual right now.
Yeah, I have that funny feeling too. Thanks very much.
Iban Udama, WSHU. Jody Latina.
Good afternoon. Governor, Mr. Stefanowski told me today that he would be interested and it has a detailed plan to do a property tax and income tax cut as part of his platform. How can you distinguish yourself different from this opponent?
taking care of business and doing what I was hired to do. We're in a very different place, Jody, than we were, 3 years ago. We were facing chronic fiscal deficits and $3.5 billion, and how are we going to manage the ship? Today we're fortunately in a different place where it looks like we're to have a significant surplus, and we are going to be able to provide some tax relief to middle-class homeowners, and at the same time continue to pay down our pension debt for the third year in a row.
Pat, Eaton, Rob, AP.
Hi, Governor. I'm wondering how much money you're prepared to spend on this upcoming governor's race, and how do you prevent this from being a spending arms race?
I don't think it has to be that at all. I think that if we stick to our message, keep it positive, talk about what you want to do for the state of Connecticut, how, from my point of view, how I think we build on the very positive momentum you've seen for the last 3 years. It doesn't have to be an arms race.
And Governor, on the juvenile justice reform, Mr. Stefanowski was very critical of you not holding a special session. How do you expect that issue to be dealt with, and what is your response to that criticism?
Not everything is solved with a special session. What we have done is we have really focused like a laser beam on those who are the most repeat offenders. We've made sure that judges have access to that information. So if somebody is arrested, we know whether that's a first-time offense or a multi-year offense. We've worked with judiciary to make sure that the arraignment is not at some point in the future, the arraignment is the next day, so that we have the appropriate facility for this individual, depending on what the nature of the crime is. We've worked obviously with our municipal police, state police. We have more cops in training, more state police on the beat than we've had before. I think we're going to try and continue that going forward. And I'll be sitting down with legislative leaders, like I said, in very soon. And if they've got some other things we should be working on together, let's sit down.
Thank you very much, Governor.
Eliza Fawcett, Hartford Current.
Hi, Governor. You'd mentioned that hospitalizations have been declining with the Omicron surge in Connecticut appearing to peak. Are you bracing for another variant, or do you think that perhaps we're nearing the end of the pandemic, or at least this stage of it?
I'm not very good at predicting, and I'm sure that Omicron is not the last variant that we are going to see, but it may be the last big scare that we have, that we may have enough, quote, herd immunity plus vaccination that any future variant will have a harder time getting a foothold in our state, in our country. And I think that's a very good thing. The hospitalizations, I always say, don't be a day trader, and 3, 4, 5 days is not a trend make, but it beats the alternative, and it is trending down. We have maybe 150 fewer people in the hospitals today than we had, a week or two ago. That takes a lot of pressure off. And just as importantly, I think we have more nurses coming back onto the battlefield than leaving due to quarantine issues. So I think we're getting to a better balance than we were, say, a couple of weeks ago.
Thank you.
Andrew Brown, CT Mayor.
Hi, Governor. Andrew Brown here. I had a question. So we've been speaking to some people about community-based testing during the most recent surge. And the consensus that we were hearing is that there definitely was not enough community-based testing capability for the surge that we saw during Omicron here in early January. This is a multi-part question. So one, why did the state, fall short of having that community-based testing capacity necessary to meet that surge? And two, does the state believe that they need to maintain a larger capacity for community-based testing moving forward, even though we may be now winding down from this most recent surge?
First of all, we learned from vaccinations and rapid tests and PCR tests how important it is to get to the community. That's part of what we were talking about with this message here. So it's not simply you go get that rapid test or PCR test at one of the major hospitals or through a primary care provider. That leaves too many people out. So we've made an extra effort to go to the federally qualified health centers and the neighborhood outreach. We had a LEAP program this summer. We're knocking on doors telling people about boosters and vaccination. So can we do better? Absolutely. But that's been the effort from the very beginning to make sure that nobody's left behind. Because if somebody is left behind when it comes to vaccination or a test, or that is bad for you and that's bad for the community.
Sorry, just on the second part there, do you think that the state needs to maintain contracts with testing partners in order to have a larger capacity if there is another surge in the future?
Look, I think so. We found out there was no national stockpile a year and a half ago, and we worked really hard to get the PPE ready to go. We had all the masks, including N95, ready to go. The United States was a little slow on the rapid testing. They had 70 different versions in Europe, and we had 2 up until the last couple of months. We all had some catching up to do there, but I think to your bigger point, it behooves us to keep these tests available. I don't know what the shelf life is on the tests yet, so I got to watch that carefully, but we ought to be able to respond quickly if there is another flare up.
Thank you, Governor.
Christine Stewart, CT News Junkie.
Hey, Governor, thanks for taking my question. So do you feel like you have done enough to address the issue of youth crime in Connecticut?
I don't think you've ever done enough. That's for sure. I know what we did do. We knew after coming out of 2 years of COVID, we really thought it was important, the socialization in terms of those learning camps. We really thought it was important with the hundreds of millions we gave for education. There'd be more counselors and apprentice teachers, in the classroom, welcoming kids back, somebody that you can talk to. On the crime side, on the other thing, I think it described already what we've done to try and accelerate making sure that a repeat chronic offender goes to a place where they can't do it again.
And on childhood vaccinations, do you think that the COVID-19 vaccine is something that should be mandated for entry to school?
I don't, not yet. I don't because it's emergency use. There have been hundreds of millions administered and they've been doing it safely, but it is still emergency use. These are our kids. I think every day there are more and more parents in that second grade or younger says, my kid got the vaccine. I feel better for it. I think my son feels a lot better for it. And your child would as well if you got it. Right now, it's that trusted advocate word to word rather than a mandate.
Do you feel that childhood vaccines should be mandated for entry to public schools? Bob Stefanowski had said differently back in 2017.
Well, yeah, back then they didn't want mandatory vaccines for anything. I think we know how important vaccines are. We've got core ones that go back, to when I was a kid are now mandatory. I think that's the right thing to do. I am holding off a little longer on COVID for the reasons I gave you. It's still pretty new.
Thank you.
Channel 12 News.
Hi, Governor. It's Rose from News 12. I just have a few questions. I'm sorry. I'm just the messenger. First of all, do you think Bob Stefanowski will likely be the Republican nominee? And then earlier today, Nancy DiNardo called him too extreme. Do you think that's fair? And then lastly, I know you mentioned this before, but just to follow up, Stefanowski has said he's pouring $10 million into his campaign to start out. How expensive do you expect this race to get? Thanks.
Well, I think I answered the last question already. I have no idea whether Bob will be the only candidate for the Republican nomination. There'll be others. There have been some names circulating around, but we are getting a little late in the day. And what was the third one?
The second question was just that Nancy DiNardo said today that he was, quote, too extreme. And do you think that's a fair comment?
Well, I just think that on some issues, the legacy of Donald Trump is a problem. And the Supreme Court is about to outlaw a woman's right to choose. So the Supreme Court is going to greatly limit our ability to do gun safety laws. People are going to have to decide where they stand on these Trump era reforms that still have life today through the Supreme Court.
Okay, last question, Brian Scott Smith.
Governor, just recently you announced almost $18 million in state funding for remediated blighted properties under the Brownfield remediation program. I've been asking you this question ever since you've been in office, and I can see you smiling because you know what I'm going to ask you. Seaside, the state park in Waterford, when is the state going to get a handle on that and do something with it by way of injecting some cash and cleaning it up?
Yeah, Brian. Well, first of all, you're right. I'm a big believer in getting brownfield remediation. A, it takes out a toxic element. B, it makes it ready for development or opportunity or something else. Right now, we used to wait until we had a developer ready to come in, then we'd clean it up. Now we have a little more flexibility. We're beginning to be more proactive in, cleaning up these old brownfields. Seaside is sitting there. It's decaying. It's been decaying there for, I don't know, decades or decade plus at this point. We've had a couple of folks who are interested in doing something with us there, which is my preferred solution, rather than just have the taxpayers of the state of Connecticut pay 100% of that. So we're still working through the nature of a partnership.
Thank you, Governor.
Okay, that concludes our program. Thank you, everybody.
Thanks, Pete. Take care, everybody.